Health Equity Forum explores the intersection of rare disease and health equity. This is the third year of the conference, and the goal of this event is to explore the persistent gaps that exist in the rare disease community for underserved and historically marginalized communities.
Every session has been intentional in the planning. This is the chance for rare disease to be elevated through the lens of health equity and really honing in to the historically underserved population.
Our healthcare system and research institutions have often struggled to provide equitable care and research opportunities for marginalized populations. That's why it's important for us to explore this intersection of rare disease and health equity and really come up with practical strategies. The agenda of the Rare Health Equity Forum is really focused around catalyzing systemic and organizational change. And it's important not just to explore the issues that underrepresented and marginalized populations face, we also need to come up with actionable strategies. And that's the reason why this year's theme is Equity in Action.
Disability is often a forgotten part of diversity, and it's conversations like this that we engaged in that really spotlighted some of those epiphanies, like those aha moments, thinking, yes, we're leaving out someone. And by nature, the rare disease community understands what it's like to be alone or to be excluded. So when we realize that within our groups there are others who are excluded, even more so, we begin to take notice, we begin to galvanize into action.
More and more people are being exposed to the need to do more for people living with rare diseases. And as we continue to collaborate and to engage different patients, we are feeling more confident that we are able to change the trajectory of people living in rare diseases, even in low-resource countries.
I'm hopeful for the future of rare disease because I believe in the human condition. I believe in the value proposition that we gain as a village, as a community, as a collective whole that shares an interdependence that we can't negate. And I believe that these spaces allow us the opportunity to begin those conversations and to recognize that we are only as good as the sum of our individual parts.
This conference makes me feel hopeful. The fact that the speakers at this conference were really positioned to be bold around equity, that we're not dancing around or like softening the conversation, means that we will have impact. That is really the key to building trust, is to be honest and direct and have the hard conversations and be uncomfortable so that we can create change.